Eboo, blood oil change, extracorporeal blood, oxygenation, ozonation. So Joe came in a few weeks ago and he did 3 blood oil changes. And what was the reason why you wanted to clean your blood out?
My biggest concerns were my hemochromatosis.
Too much iron, ferritin in your blood.
Way too much iron and ferritin. And then also I had measurements of my PSA where it was about 4.6 is what it was. And since I had this, it went down to 0.06.
So they said you were pretty much at early onset prostate cancer.
Yeah.
Okay. So what we did was, this is a typical result of, before we take the bad plaque and inflammatory proteins out of the blood, typically it's dark, poorly oxygenated, and you could see sometimes plaque. These are not air bubbles, these are solid plaque that we actually filter out, and you can see we could clean the blood where it's thin, highly oxygenated, and deep plaque. So I'm going to show you Joe's results here. So you can see his before blood was very thick, poorly oxygenated when he did his Eboo treatment. And then you can see all the plaque in his artery before and inflammatory proteins. Some of the proteins are called beta-2 microglobulins, which causes cancer. You can see the before plaqued up blood is very dark and inflamed. Look at the after blood. It's bright, richly oxygenated and deplaqued. So Joe had 3 of these waste containers with all these waste products: urea, heavy metals, plaque, probably mold, viruses, bacteria, and again, inflammatory proteins called beta-2 microglobulins. So 3 of these canisters.
3 of those canisters.
A typical healthy patient maybe would have a little clear liquid at the bottom, but nothing like that. All right. So personally, I did 6 Eboos myself, and you can see my blood was dark before. Look how bright red it is after. So my before blood work, before starting my Eboos, I started it in May, and I did it for 3 months, 6 sessions, and my total cholesterol was 208. After 6 Eboos, it's 141. This is my bad lipid. Apolipoprotein B was 90. Now it's 62. It's normal. My hemoglobin A1C was 6.2 pre-diabetic. Now I'm normal at 5.6. My hemochromatosis, I had too much iron, high ferritin in my blood, 456. Now it's 48. Get back up. So Joe, what was your ferritin? What was your hemochromatosis before? You said it was 1,000? 800? It was like 800?
Yeah, over.
And what was it after the 3 Eboos?
After the 3 Eboos,
down to 100, you said?
100.
Less than
Less than
100.
100.
So you're like me, you're in the normal range.
Yeah.
30, yeah.
And I also noticed that my vision has gotten better.
Yeah, because you're getting more blood flow to your eyes now and
Yeah.
oxygen, yeah.
Mm-hmm. So actually I had a good visit with the eye doctor too.
Yeah, that's good. And he doesn't know what this stuff is, so, yeah.
No.
Yeah. So there you have it, folks. This is how we not only clean out your blood just for overall heart, blood vessel health to prevent strokes and heart attack, also boost your immune system to fight cancer and improve your organ health, whether it's your prostate, kidneys, heart, liver, spleen, whatever. And
wake up with more energy too.
And more energy too, yeah.
Yeah.
I mean, even his wife had it done here. What did you notice after your Eboos?
Oh, I had tons of energy after my Eboos. I would just do everything to get up in the morning. And now I'm up at 5.
Yeah, there you go.
Automatically.
Yeah.
And before I was struggling at 9 o'clock to get up in the morning.
There you go.
And now I'm not. And my eyes were 20/40 before the Eboo. And I had them checked today, and they're 20/25.
There you go. Well, we won't charge you for that nice side effect, all right?
No, that is wonderful. Yeah.
Well, here you have it, folks. The question is, what's in your blood?